There are now 1.34 million people in this state on health waiting lists. 893,000 of those are on hospital waiting lists. It is an absolute scandal that has been decades in the making. It's a result of mismanagement, incompetence and a lack of political will to address the gross inequalities that lie at the heart of Ireland's health service. This inequality is illustrated by the undeniable fact that access to healthcare is often determined by one's wealth and where one lives. Week after week, I speak to people waiting for essential treatment for themselves or their children who have been blatantly told that if they can go private, the care they need will be provided virtually immediately. For those dependent on the public system, they tell me, they also tell the government, if they listen, that geography can determine the level of care they receive. All too many of the problems we face originate in the failure to deliver proper working primary care services. In County Monaghan, the decision of previous Fianna Fáil and Fine Gael governments to remove services from Monaghan Hospital continues to have serious negative repercussions. A&E services were withdrawn from Monaghan and resulted in drastic overcrowding at Cavan and Drogheda hospitals. A minor injuries unit was eventually established, a great service that should serve to ease pressure on both GP practices and A&E departments. But the MIU only operates Monday to Friday 9 to 5, in contrast with most other minor injuries units which operate 7 days a week, 8 a.m. to 8 p.m. On top of that, for non-GP referrals, there is now a fee of €75 for patients to attend. And the result of this, of course, has meant that the numbers attending the MIU are now reducing, while the demands on GPs and A&E are ever growing. It is as if government is actually trying to make a bad situation worse. So the Minister, Laskin Corla, has asked for practical solutions that can help ease the crisis in our health services. So here's one. Open all minor injuries units, specifically Monaghan, to 7 days a week, long hours services, and remove the fees associated for MIU presentations. Because governments refuse to listen when we warn them of the consequences of withdrawing services from Monaghan Hospital, I sincerely hope, Ministers, that you will listen now.